Hello, I'm Helen Allett from the Liverpool School of Tropical Medicine. We're going to be thinking in this lecture about teaching methods and strategies for mentors. So our objectives are to describe various teaching methods, to understand how these might apply during our mentorship, and then to think about how we would develop and run an interactive teaching session. When we teach, we learn again, because as we prepare, we learn more, and we often update ourselves in the process as well. So it might be something that you think a topic you've known about for a long time, but as you prepare to teach it, then you will get the latest materials and updates, so you learn again. Remember that when we teach people, we want them to learn. That's our objective, is that the learners should learn, and that they should be able to improve their practice as a result of that learning. Sometimes when we teach, we either teach in the way that we think we would learn best ourselves, or else in the way that other people have taught us in the past. That's okay, but we need to remember that this may not work best for everyone, and so we need to be flexible. And remember that different methods work best for different learners and for different topics. You could think about the different ways in which people learn and think about how you have learnt best yourself. So what are the ways in which people learn? Well, we can learn by reading things or listening or watching or trying something out with somebody giving us feedback as we go along, or it might be a combination of these, and we all have different things that we can learn better by different methods. So for me, for example, if I was learning to do a new skill on the computer, I would need to try it out with somebody giving me feedback. Just reading about it wouldn't be sufficient. I'd need to actually try it for myself. It might not be the same for you. So what do you think contributes to effective learning? And in thinking about this, we want to think about active rather than passive learning. What does that mean? So active learning is taking part and owning some of the learning for yourself. So that means participating, and to an extent, active learning should be student driven. So the student makes choices about what they need or want to learn. Learning can be interactive, and it can be interactive either with other people or with a computer. So you could fill in a quiz on a computer and that would stimulate your learning, for example. And sometimes when we need to learn skills, it's very good to repeat them, because if a skill has multiple steps in particular, it may be difficult to remember all those steps and the appropriate sequence unless we repeat. And that's why we often repeat our skills and drills, especially for things that don't happen very often. So where do you think that learning can take place? Just pause for a minute and think about this before moving to the next slide. So learning could take place almost anywhere. We could have formal learning in lectures, or we could learn in a skills laboratory, or in a simulation centre. We could learn in a library or on a computer via the internet. We can learn in conversations with each other and our work colleagues. We could learn on the ward, perhaps on ward rounds, or in the operating theatre, or in the outpatient clinic. All of these are appropriate and relevant places to learn. We need to think about how this location of learning can be applied to the mentorship relationship, and how the mentor could relate to the learner in these various different situations. And particularly, I think appropriate for mentorship is learning side by side together on the ward or in the operating theatre or the outpatient clinic, as you may see patients together with your mentee. And I think each of those situations can turn into a learning situation as you provide mentorship side by side. can you think about different teaching methods that you know about? Perhaps we can think about using a flip chart or a whiteboard to record these, and then we're going to move on to another slide where we've listed some teaching methods. So I'll just let you pause for a minute to think about, maybe you could write down some teaching methods that you're aware of. There are indeed many methods of teaching and learning, and I've just listed some of them. I'm sure there's others as well. But there are lectures, small group discussions, case-based learning, where you take a clinical case and use it as a foundation for discussion and learning. Specific workshops, or having assignments such as self-directed learning, such as homework to do. In a way, that's what you're doing now by listening to me. Seminars, we can learn through games, problem-based learning when you start with a specific problem and then your learning develops outwards from that, and that's often the way that medical students get taught nowadays. So you might start with a problem such as asthma, for example, and then you would learn all about the lung physiology and anatomy and pathology and the pharmacology and the treatment for asthma. We can learn by demonstrations, watching demonstrations. We can learn through taking part in debates, role-playing, brainstorming, or going through scenarios and simulations, watching videos, visiting institutions on study tours, searching on the internet, or learning skills side by side with each other. So there's very many different ways that people can teach and learn. And they all have their place for different skills and knowledge that we need to acquire. Let's just think for a minute about the disadvantages and advantages of some of the commonly used teaching methods that you may come across. So we're going to think about clinical demonstration, how to teach a skill, or simulation using mannequins, role play of a scenario, and lectures. So let's start with skill demonstration. So when you're demonstrating a skill, first of all, the facilitator will demonstrate the skill, perhaps on a model, as it would be in real life. And ideally, they should first demonstrate without saying anything, so that the participants can just watch, so that they're using all their visual skills and they're not being distracted by any sound. And then the facilitator should demonstrate the skill again, but this time with a running commentary, explaining each step involved as they go along. And then for the third step, the facilitator should perform the skill while the participants give comments as to what the facilitator should do next. And finally, the participant should perform the skill whilst explaining to the facilitator what it is they are doing. However, this four-step process is very time-consuming, and it's often not feasible to go through every one of those 4 steps. So sometimes we leave out steps 1 and 3 and move from the facilitator demonstrating the skill with the commentary to the participant performing the skill whilst explaining what they're doing. Once competency has been achieved, then progress can be made from models and mannequins to actual patients. So it's a good way of learning without putting patients at risk doing various skills. For example, perhaps repairing an episiotomy could be one skill that you could learn in this way. And it's good that there should be a continuous cycle of practice and feedback and practice that should follow the learning of the skill during the mentorship process. So the mentor should give feedback to the student or the person learning the skill so that they can continuously improve. And the mentor can also encourage self-generated feedback, of course. Moving on to scenario or simulation. This may be done. Participants will learn in this way by doing, and because they're learning by doing, it's likely that this would be associated with perhaps better progress in practice. And the skills that people can develop in this sort of way would include communication skills, as well as clinical skills, documentation skills, and situational awareness. So what do we mean by situational awareness? It's everything that's going on around you. So it's not just putting the blinkers on and thinking about one particular issue, but taking everything into account. Roleplay is a very useful learning tool, and it's very particularly helpful with learning communication skills. So you can choose participants to have various roles and then describe the roles to them, and then they can role play that role. And you might find this particularly useful, for example, in teaching people how to break bad news, demonstrate respectful maternity care, or take informed consent. Lectures are very useful because you can reach a large audience simultaneously, and that makes them very efficient for the transfer of knowledge. However, they might be a bit less effective for retention, or not so useful when it comes to the application of practical situations. So lectures need a lot of strategic preparation to make the most of them. How do you think you could make a lecture more effective? What do you think makes a lecture interesting or boring? Just pause for a minute to think about what it is that might make everybody listen to a lecture in rapt attention, or else might make them look at their Facebook on their phones under the desk and not concentrate. Think about what it is that affects the usefulness of a lecture. Sometimes you can hear lectures from absolute experts in a certain field, but they're really hard to listen to because they're not engaging. And so very important that we think about strategies for effective lecturing. And we want to be as interactive as we possibly can be in the time allowed. So that means asking questions. Sometimes you can pause a lecture and ask the student to just talk to the person beside them, or in threes about a particular issue, to make them take part a bit more. And then certain groups can be asked to give feedback to the entire class. Try to illustrate your slides, sometimes with some pictures, not just words, because that perhaps may grab people's attention a bit more. Although equally, we don't want to divert them too much from what is being said. So pictures should be relevant, illustration should be relevant. And think about giving examples of situations in your lecture that chime with the local situation, that are relevant to what's going on, and not something that would never occur in your location. And always ask for feedback from your lectures. It's very good to have a peer listen to your lectures, a colleague who can give you some effective and useful feedback so that you can improve your lecturing skills. So discussions as a way of learning, well, those are very good for helping people because they make them think and actively participate, and they're learning then by thinking and talking and relating to other known things, and people can apply principles and logic to arguments. So you could think about how you could perhaps facilitate discussions in your with your mentee group. Just remember though, when you're doing this, that some people are naturally more extroverted and may have a lot to say, whereas people who are naturally more introverted may be a bit more shy and may feel a little bit overpowered by the extroverts. So just try and bear that in mind and be ready to draw people in and invite everybody to make a contribution. Brainstorming is a kind of a discussion, but usually for a topic that is perhaps not so familiar. And there's no right or wrong ideas. The aim is to generate ideas and try to make sense of them. And brainstorming is particularly useful for planning projects. So facilitation, to be effective, involves doing a lot of preparation. So there is no substitute for good preparation. And if you don't prepare and you don't know the topic yourself, then it will not come across well. And think ahead about how best to get the participants involved as you prepare the teaching. What strategies are you going to employ to pull the participants in and encourage active learning? So for every session that you run of any sort, it will always have these three points. First of all, the set, which is the start, if you like. And in that, you must state the learning objectives. It's really, really important that we tell people what we want them to learn, what we intend that they will learn from the session. It might be that you can link it to the previous session that they may have just done. And the other thing to do is to have any equipment you need ready. So no good trying to get it out as you go along. Make sure it's all there and in working order before you start. And then the delivery of the session, which you do step by step. And as you go along, you are going to check the understanding of the participants to make sure that they've got what it is you're trying to say, trying to teach them. You need to think about pacing yourself as you deliver the session to fit in with the allocated time. And then as you come to close, it's really important to summarise and to remind the participants what it is that they have learnt in that session. And then you could link it with the next session that's coming up if that's relevant as well. So tell people what they're going to learn and then make sure they learn it and understand it, and then tell them what it is they have learnt, what the key takeaway points are. And it's very good to give people key takeaway points to focus on, because sometimes when they're going from session to session, they won't remember later what it was they learnt unless you really summarise effectively. So as I said, that whatever type of teaching method you use, those 3 steps do apply. Think about questions in advance that will facilitate the engagement and help the participants to concentrate, and then make sure that they have understood, and also invite questions from them. So make sure that they have the opportunity to ask any questions and clarify any points that they're not sure about. And think about how you're going to prepare group or individual learning activities. So in summary, in this talk about teaching methods for mentors, we've thought about how it is that people can learn and what will work to achieve the goals that we set for learning. We've considered that learning activities are always best when they're interactive and participatory. And we've thought about how we might choose a particular teaching method based upon the gap identified and the desired learning outcome. So, for example, practical skills, communication skills or attitude, or a combination of those. And teaching activities will always be delivered in those 3 parts: the set or the preparation, which includes the announcement of the learning objectives, the delivery, and then the closure, which includes summarising what has been learned.